Hello, everyone. My name is Suzanne Robertazzi. I'm a nurse practitioner here in Washington, D.C., and I work at the Washington, D.C. VA Medical Center. A lot of my background is in transplant, but I'm happy today to talk about the role of exercise in liver health. As we know, exercise is really important for all parts of our body. There's a big focus historically on heart health and exercising, but we know that exercise is just important for your liver health, especially when we're talking about patients who have risk factors for MASLD or MASH. And really, a lot of exercise, we all know we should do it. Our patients know we should do it. But how do we encourage them to be able to really sustain and start a program? So really having a supportive environment. You don't want to go into your patient. You want to have empathy and really understand where patients are coming from and meet them where they're coming from. You may work in an advanced liver cirrhotic clinic and patients aren't able to get up and walk 2 miles. So you really want to meet them where they're at and kind of give them realistic goals that they can meet. It's also where physical therapy can be a really good help. I know in our clinic, we have a physical therapist that sees all of our transplant patients, and she's really available both pre and post-transplant to help guide patients and help give them a good exercise plan that they can follow. So not only do we need a supportive environment, we want to be encouraging. We want to set realistic goals. You don't want to give a patient, you have to, everyone should do 30 minutes of exercise a day. Well, yeah, we should, but they may not be able to do that. And then that can really be kind of a downfall, can kind of really discourage patients to understanding what they can actually accomplish. Other things that we want to keep in mind are matching our exercise with diet. So we know that a diet is very important and can be combined with exercise to be able to give our patients the best outcome. And also we want to work on continually following up. So you want to set a goal. You want to check in frequently with your patients. You want to provide positive encouragement. So a patient reaches that goal, you're going to celebrate that accomplishment and then set the next goal. A lot of times I find giving my patients step goals. So if they have, everyone has a smartwatch. A lot of people have smartphones. They can count their steps. You can give them a goal. You can celebrate that they've reached that goal and then move on to the next goal. So it's really important. Finding an exercise that also works for a patient is important. So while walking is a great exercise, it may not be available to everybody. Maybe swimming. Maybe there's a pool nearby. So trying to work in the community and find avenues where people can exercise. And cost can be, a factor too. Some of our patients won't be able to afford a fancy gym membership. But there's a lot of things that people can do that don't cost money, whether it's at the local Y or taking classes. We know that classes or group environment, exercise environment also helps our patients kind of keep up, stay motivated, having that support of an exercise group with you, and maybe people that are in the same age group. So whether, you're going to a senior center to exercise or you're a younger patient and you're going to a place where there's younger kind of patients in your same age group, that's important too. Other things that we can do. So we talked about positive reinforcement, also like behavioral therapy. So we can understand that maybe some patients need counseling. There's had different stressors, different traumas in their life. So we can use behavioral therapy and our colleagues in the mental health to help us to kind of help support our patients in their goal. And then also working with nutritionists. So we talked about diet is an important part. So not only exercise, but diet. So working on meeting patients where they're at, understanding what foods do they have available and kind of setting forth a meal plan that really matches what they can accomplish, what they have available, what financially they can afford, and what will meet both of your goals. And then using tools. So we talked about setting goals, meeting those goals. So you can have a diary, like an exercise diary, what you accomplished, and then they can bring that to clinic and share it with you. So that way you can help celebrate those goals and provide positive reinforcement. So I'd like to thank you for joining me today, and I look forward to talking with you at our next time.